Chronic Fatigue Syndrome by Josh Schoenberger, Daniel Hernandez, and Bryant Hernandez-Servin. Causes of CFS have not been identified, and no specific diagnostic tests are available at this time. Since many illnesses have incapacitating fatigue as a symptom, care must be taken to exclude other known and often treatable conditions. Before a diagnosis of CFS is made, some assumed causative agents, but not limited to, are Epstein-Barr virus and cytomegalovirus virus, which are both in the herpes virus families. Another is Coxsackie virus, which is in the poliovirus family, and another is xenotropic immune leukemia virus. Triggers for CFS may include infections, immune disorder, stress, trauma, and toxins. CFS is a diagnosis based on medical history, illness, symptoms, physical examination, and exclusion of certain illnesses using a standard group of laboratory tests. Additional tests such as imaging and physiological assessments can also be used. MRI or other neuroimaging procedures to test for diseases such as multiple sclerosis, and also physiological testing such as sleep studies, exercise testing, including VO2 max or tilt table testing to address specific questions, as well as multiple blood tests. There is no published data to indicate that CFS is contagious, that it can be transmitted through intimate or casual contact or by blood transfusion, or that people with chronic fatigue syndrome need to be isolated in any way. Therefore, transmission is unknown. CFS often affects patients in cycles. Patients will have periods of illness followed by periods of relative well-being. For some patients, symptoms may diminish or even go into complete remission. However, they often recur at a later point in time. This pattern of remission and relapse makes CFS especially hard for patients to manage. Patients who are in remission may be tempted to overdo activities when they're feeling better, but this overexertion may actually contribute to relapse. Some symptoms include muscle pain, profound fatigue, insomnia, headache, sore throat, irritable bowel, joint pain, depression, or mood problems. Feelings of anger, guilt, anxiety, isolation, and abandonment are common in CFS patients. While it's okay to have such feelings, unresolved emotions and stress can make symptoms worse, interfere with prescription drug therapies, and make recovery harder. Common difficulties for CFS patients include coping with a decrease in stamina that interferes with activities of daily life, memory and concentration problems that seriously hurt work and or school performance, loss of independence, livelihood, and economic security. For a patient to be clinically diagnosed, they must experience symptoms for 6 months or more. The most effective treatment for CFS appears to be a two-pronged approach that combines psychological counseling with a gentle exercise regimen. A physical therapist can help determine what types of exercise are best for the patient. Inactive people often begin with a range of motion and stretching exercises for just a few minutes a day. If the patient is exhausted the next day, they're doing too much. The patient's strength and endurance will improve as they gradually increase the intensity of their exercise over time. Psychological counseling, talking with a counselor, can help the patient figure out options to work around some of the limitations that chronic fatigue syndrome imposes on them. Feeling more in control of your life can improve your outlook dramatically. Treatment for chronic fatigue syndrome focuses on symptom relief. Because chronic fatigue syndrome affects people in many different ways, a patient's treatment will be tailored to their specific set of symptoms. Symptom relief may include certain medications, such as antidepressants. As stated before, many people who have CFS are also depressed. Treating their depression can make it easier for them to cope with the problems associated with CFS. Low doses of some antidepressants can also help improve sleep and relieve pain. Alternative methods of medicine such as acupuncture, massage, yoga, or Tai Chi may also be helpful in treatment. A balanced diet can be favorable to better health in general and would be expected to benefit a person with or without any chronic illnesses. Safe sex practices, proper hygiene, reduce stress, improved sleep habits, and avoiding overexertion would help in prevention of CFS.